we can correct the deformities of the foot gradually by manipulation with our hands, and then putting and retaining the foot in a plaster in each position when we correct it. That means
Hello and welcome to yet another episode of Story Molly. In today's episode, we are having an interesting conversation with a doctor. Come with me. What is clubfoot or clubfoot?
So clubfoot is a complex deformity of the foot. We still don't know exactly the reason why some people do have clubfoot deformity, but it is a deformity of both of the bones, of the ligaments, and of the muscles of the foot, 1 or 2 feet.
According to research, it shows that boys are more prevalent or common to have clubfoot. Is there any reason behind that?
Well, probably there is, but we still don't know because we cannot isolate the reason that causes the clubfoot deformity.
Okay.
We do have complex neurological pathologies that where we see clubfoot more often, but the real idiopathic clubfoot, it doesn't have any known reason for causing.
So that means also for pregnant women, some conditions can be detected when they're pregnant, but for clubfoot, do you think it's possible to detect it?
Yes, sometimes, and with new modern technology, with new ultrasounds, the clubfoot deformity can be identified during pregnancy. It is impossible to say if it is a real clubfoot, an idiopathic clubfoot, or if it is a positional clubfoot. That depends on the small space in the womb that causes pressure on the foot.
Not so many people are aware about clubfoot, but according to you, do you think it's very common, and why do you think people are not aware about it?
Well, clubfoot is a deformity that we meet in about 5 to 100 births, so it is not a very rare disease. It is not very known popularly because with the new methods that we treat them, we can get a very good foot that doesn't look like a clubfoot very early in the childhood, so it is not seen afterwards, so people don't get to know it usually. So maybe this is one of the reasons.
What is the available treatment for clubfoot?
So the most known and most practiced treatment at the moment is the Ponseti method. Ponseti is a colleague, a doctor who introduced this method initially. So his principle is that we can correct the deformities of the foot gradually by manipulation with our hands, and then putting and retaining the foot in a plaster in each position when we correct it. That means that we can do a serial casting of about 5 times, 1 casting every week or 10 days, until we achieve a better position of the foot. Usually we need to do a tendon release at the back of the foot, of the Achilles tendon. It is not always necessary, but most of the times we need to do it.
What are these things?
So this is called Mitchell boots. This is used directly after the Achilles tenotomy or the treatment with the serial casting. It is used to retain the position of the foot and to reduce the relapse percentage. So by using this kind of device, the people who get clubfoot again after their treatment has reduced dramatically.
Once the child has been treated, can they use their legs normally like people who do not have the defect?
Yes, so people with club feet can live a normal life. They can participate in sports and they can do whatever they like. Unfortunately, some club feet will meet problems in the future. Very few of them will have limitations on their movements or on the sports participation, but usually we do not have any limitations in the future.
What is your final advice to parents who have just found out that the baby has club feet?
So a clubfoot deformity, it is a complex deformity. It is sometimes difficult to treat, but it is treatable, and with persistence and with controls and with new methods of treatment, the they do not have anything to afraid, their children will have a normal life.
Thank you so much. That's it from my end. Thank you so much for watching. If you like this video, like, share, comment, and subscribe. Remember to hit the notification bell so that you can get notified every time we upload a new video. Should you have concerns about your baby, remember to contact your local doctor, or you can write to us. Until next time, my name is Maureen Murray, and this is Story Molly. Bye.